Hello and welcome to PM Express. And this weekend, fortunately, I don't think I have good news. We're looking at the no bed crisis. I don't know whether to add syndrome. But as a nation, I am hoping that I'll live to see a day when there will be no Land Cruiser crisis. But no, there's abundance of Land Cruisers, but there's a no bed crisis. And it stems from two angles, because if you leave your health care with people who don't need it in terms of emergency, well, that's a big gamble as a nation that we are taking. That those who are in charge of our health care can fly out to countries who, pay attention to their health care. And then there's the other side where there's so much hardship that lots of people who are going into the health sector, not the doctors, but maybe below, are there because they need a monthly wage. Health, being a nurse, it's a calling. It's a passion to see people get well. It's a passion to comfort people. And so if you find yourself in there just because at the turn of the month you get a pay, it might show. And I might say, if I were to open the phone lines and ask attitudes of nurses towards people, we will be flooded with gory and disgusting stories. So there are people there who are just there for being their sake. Yes, I understand that facilities, obviously are not up to date. But you see, one thing I realize is, look, we could be walking along the street in the market, and if a bicycle or motor runs somebody down, everybody rushes to the aid of this person, and even though they may cause more harm than good, but in their hearts, they want to comfort the person, find help for the person. And so if somebody turns up at a hospital with that emergency, we all assume that the people who work in the hospital would show some empathy. Maybe I can't do anything for you, but get a glass of water and take a paracetamol and go on to the next door. But here we are, where a 70-year-old man, God bless his soul, passes away because they went to 7 different hospitals. And according to the story, each hospital they went to, they were told, go to the next one, go to the next one, go to the next one. From the layman's point of view, from my point of view, could they have checked his blood pressure, see if he was bleeding, breathing, if he was alive? Could they have comforted him in any way? Could anything have been done? I don't know, but that's what we are here to discuss from different angles, Neglect of government, neglect of personality, a whole attitude towards our health care. And if health is life, then what are we doing with our life? My name is Nana Sakwa, the 4th Chief of the Little Republic of Akwemo-Dumasa. When I come back, we are discussing no bed crisis. Don't go. Well, thank you very much. With me in studio is Dr. Gabriel Bananku, President of Coalition of Health NGOs. No stranger to the show at all. Doctor, you're welcome.
Thank you.
Great. And then I have, I think it's my first time, Dr. Titus Bayo, who is the Assistant General Secretary for Ghana Medical Association. And indeed, when the issue happened, they released a statement pointing out a few things, a few flaws which they find in the system, and that's what we're here to discuss about. Hopefully it will be in English and it will be very frank, and let those who have ears hear it, and the chips should fall where they may. So I'll start with you, Titus. Yeah. Very, very, it's not new. Yeah. But somehow I think 7 different hospitals, the same attitude, made it stand out a bit. But we've had so many times when patients is told, look, there's no bed, go to the next one. Even pregnant women being sent away. But 7 different hospitals, and I'm sure out of these 7, nobody has these guys, blood pressure, temperature, eyes dilating, pupils dilating, whatever. It's just, move on to the next. That's what gets us all a bit worried. Doc, what's the GMA's position on this story?
Okay, thank you very much for having me. And I should start by first of all wishing our Muslim brothers, Baraka de Salah,
Thank you.
and some colleagues who are celebrating, and also say a very good evening to all doctors and healthcare providers who at this holiday and even this very minute are giving of their very best to ensure that people who need their care get it. But it suffices to say that it's a very sad story, and we express our deepest condolence to the family. It's a very, 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 very sad and tragic story that no one can explain away. It can happen to anybody. And I think, like you've mentioned, I do not know whether this is the first time that somebody have had to go through 7, but I'm sure people have gone through maybe more or less, but we don't have the records of that. And how the chain of events happened is quite disturbing. I should add that the facts may not exactly be as it looks. I am aware of an investigation going on by the ministry, that the Medical Association is part of it, and preliminary information we are getting, some of the facts are not exactly what we are seeing, but we would wait for the full investigation to see, because I am sure that at some point somebody checked the pressure somewhere. That said, sending this man away from place to place is very unfortunate, and I don't know how anybody can explain that away. And we would want to see exactly what happened. Could it be a victim of unfortunate circumstances that all these 7 places actually were full? I doubt that very much. Could it be an attitudinal problem, that it was just unfortunate they happened to have met people at a certain time whose attitudes were terrible? It could be. And so I think we would all wait for that results, and we are eager to see what the investigation reveals. And if there are individual factors of negligence, of failure of duty of care, we would wish that the people who are responsible are brought to book.
See, Doc, you are probably secondary or tertiary facing in terms of patients.
Yeah.
The primary are the nurses and the front desk people. Do you have any means to, I don't know, mystery shop them to make sure that, look, you are treating people cordially, or they are just left to their own until you hear, Joy FM announce that, look, I turned up at the hospital and this is what happened, before you realize, oops, front desk is not behaving?
Well, it varies from facility to facility. But I would say that in all facilities, what we are encouraging is that for every shift, for every duty, we have senior people in charge. We have a prescriber in charge. If there's a doctor there, there'll be the doctor in charge of that duty. And if you listen to the story, at some point they were not even certain whether the people who send them away are security people or they are professionals. So it makes it difficult. That's why I'm saying we should wait for the report. But in my facility, for instance, even in the unfortunate circumstances where sometimes we've had to close down, we station a doctor at the point of entry who assesses the patient, find out where they can go next. And even in that time, there are some people who cannot move, and we take them in and find a way of trying to handle them. It's one thing taking in a patient that you cannot do much for, because the patient can sue you. If the patient needs surgery and you can't offer that surgery, and you take the patient in and keep the person till the worst happen, the person can take you on. So it is imperative for you to get a person to the next level that the person can get that care. But I think that one recommendation that is certain to come from this is, at what level can that decision, that call, that move to the next facility be taken? And when that level is defined, we must demand same of everybody. In other words, it should not be possible for a security man to give you an information that we have closed. It should not be possible for maybe an orderly or a cleaner or a nurse to give you that directive, move to another place when there is a doctor or a physician assistant or a senior nurse or a midwife. Because we have different facilities. There are facilities that are manned by only nurses. Like a maternity home, you may find only a midwife. So at that point, we expect a senior person like that midwife to be the one to say that this patient must move on, and not a ward assistant or somebody lower. So I think if you talk about mystery patients coming in to test the system, it's not a bad call. And it is something we have actually suggested to the ministry as well. And these things happen at certain hours of the day. It's not rocket science. It's something anybody can investigate. Almost always they would happen at the weekend. They will happen in the night, wee hours of the night, when at other places people are busy breaking their backs trying to work. Possibly at other places somebody may just be tired or not want to and try to find excuses. And we cannot hold brief for such. And so for those ones, we need to fish them out and deal with the situation.
Dr. Benako, I mean, the question again is, I mean, if somebody came into your facility, he's been hit by a car, he's falling off a skyscraper, I mean, aren't you able to advise that, look, take this person to 37 or take this person to police hospital or take him to Kaneshie? Before you do that, you need to at least see.
Exactly.
Did they even come with the patient at all? Or, I mean, how does it work in the medical?
Yeah, thank you. I'm not a medical doctor, but I'm a sociology by medicine. So I quite understand over the last 22 years as a health advocate, understand the system within the Ghana Health Service and even the WHO standards that Ghana is using. When a facility is called a CHIP compound, there's a reason why it's called a CHIP compound. When a facility is called health post or health center, there's a reason why it's called a health center. And when a facility is called a hospital, a district hospital, there's a reason why it is called that. And when it is called a referral center or regional hospital, there's a reason. All these are mentioned have protocols and guidelines. They have standards. So you cannot call a CHIP compound a hospital. So when you call a facility a hospital, it means all the things that befit a hospital must be there. So for us, civil society, it's very unpardonable to see a patient moving from one hospital, purported hospital. It's already accredited by the Ministry of Health, Ghana Health Service, that this is a hospital. That hospital that is supposed to discharge all the protocols, the reason why it's giving that license to operate, they cannot discharge it. So somebody must die because they cannot discharge their duty. So it's very unacceptable whether there's an investigation ongoing or there's no investigation. We do not accept any kind of excuse. Those hospital or health facilities must be brought to book and they must be dealt with unconditionally. These are the reasons. You see, at the hospital, and doctor know what I'm talking about, once it is a hospital, somebody is supervising somebody. That's why we cannot understand it. Once it's a hospital, somebody is supervising him, for example, if he is on duty. He is not a supervisor on his own. Somebody is supervising him because it creates that opportunity for if there are overlaps or if there are some issues that are flagged, somebody with the third eye can see, so can draw his attention for standards to be followed. At the entrance, every hospital, there's always that opportunity of emergency response team. So you cannot have a hospital and there's no emergency response team. Now, if the emergency response team is there, what it also means is that within the hospital facility, that response team is also connected to other hospitals around it. That should also be, that things can be easily communicated to the other hospital in case they are not able to admit, or if they have situations and they think that they can refer to the nearest higher or much more opportune facility. That those arrangements could be made easily. In fact, the patient should not suffer trying to look for a facility because they are in facility A and facility A is not able to provide the needed services that they needed. No. So whichever way you pick it, we are still wondering why these things are happening. The other issue is that it is just not understandable for a health facility to exhaust all the available bed facility at the facility without knowing that they are in a danger zone. Because every facility must always have 2 or 3 beds that are reserved for critical situations.
What if 3 critical situations turn up?
So it is very difficult that while you are making arrangements to absorb any emergency within that time, the emergency response team should be making arrangements to make sure that they stabilize conditions. So that's why I'm saying that whichever way we take it, we civil society think that this is not something that at 61, Ghana at 61, should be dealt with mere issues killing people. Issues that you and I contribute our taxes to ensure that they are properly taken care of. We flag them and we are killing people. The last submission I want to make on this issue is that the issue that has happened has called for a national review of our hospital protocols. So until we as a country see health as a society issue, we call it sociology. Sociology, until we begin to see that it is not only the doctor and the nurse alone who can manage the facility and discharge their duty very well, until we begin to bring in other medical teams, sociological medicine, into the health system, and or if you like, public health, critically, so that they can understand the societal issues properly, so that they can connect with the issues happening. For example, Nana, if you get to a hospital and there are crises, patients cannot pay for services. It doesn't mean that they should not be taken care of. They must be taken care of, but there's a social worker. The hospital must make sure that there's a social worker there who should understand the languages of those vulnerable and poor people. Because the Constitution has made provision for everybody. But there are exceptions. When there are exceptions, the social worker should be able to connect with the medical team and the patient and others, so that that person can still have the same service as the rich people will have. So all these things, we should find them in a hospital. We don't need to tell the hospital management to put in place those things. You must have social workers in the hospital. The social workers must be connected with the people. The front desk of every hospital, these days I see they call it customer care. The customer care unit really need to be looked at, because when I get to a facility and I'm frustrated, somebody sitting at the customer care should rather cool down my stress. But to be surprised, that is where they will even annoy you the most and get you more frustrated.
Let me bring
So these are the critical and realities that we are finding emerging in our health system. Over the last 10 years, we have not looked at them. We have not seen that the country has given birth to over 12 million Ghanaians in addition to what we had planned 10 years ago. So we keep on repeating the simple mistakes that we have planned for.
Dr. Benio, is it an ideal situation that Dr. Banako is describing, or is a reality that he's talking about?
I think I can understand him, but the reality is that what he's describing is ideal, is what is on paper, but in practice, it is not what you are likely to find. And I can understand his frustration, and I can understand the frustration of any Ghanaian. And as a Ghanaian, I also say that no reason, no excuse is acceptable. And the second leg of it is that we need, if we say it is not acceptable, where do we lay the blame and how do we correct it? That is where I think this unfortunate event should lead us to as a people. But before I give some suggestions on that, I think the Medical Association in our statement called for adherence to our protocols developed by the ministry. He was talking a lot about protocols, international standards, and all of that. Adherence to protocol requires certain infrastructural support, without which it is virtually impossible. And if you talk about, let's say he was talking about it's not possible to exhaust all beds. And whilst you are at that, an emergency response team should know and should be able to arrange with the other hospital. That is, in fact, like I'm saying, I understand how he will feel and I understand how anybody else will feel, but I have the opportunity of seeing the other side of the coin, being a service provider and seeing what the situation is on the ground. It is very possible, may I submit, very possible that all beds can be full. And we are not talking about all beds as in if you take Korle Bu, it's a 2,000 bed capacity. We're not talking about 2,000 beds of Korle Bu. And so in our statement, we mention functional emergency units. You can have emergency units that are not functional. The emergency unit of Korle Bu that trained me 10 years ago, 12 years ago, 15 years ago is the same emergency unit we are having. The same number of beds at the emergency. The population of Ghana has increased. The real fact is that supply has exceeded, demand has exceeded supply. The Ghanaian population has increased, the demand for emergency services has increased, but supply has not seen a commensurate increase. And so if you take a hospital like Rich, Korle Bu, any of our major hospitals, on a typical busy duty day, you can exhaust all your beds completely, the emergency unit, you can exhaust them. I'm sure you have heard of situations where people need intensive care, and you go to the intensive care unit of Korle Bu, you have 6 beds, and the beds are in use. Ethically, you cannot disconnect somebody who is on a ventilator to give to another person, because all persons are equal, and they have equal access to life. So you can have a situation where your emergencies completely fill up, and it happens almost every day. In fact, since this event, and people are trying not to turn away anybody, I have seen pictures on social media, and I'm sure some of our viewers have seen that, where people are being nursed on the floor, giving all sorts of treatment on the floor. I think it is high time as Ghanaians we say enough is enough. We deserve better than that. So in the practical world, it's possible. He also talked about whilst you realize that you are running out of beds and you have an emergency, you should be able to call the other place. Currently, our referral system is in shambles. Let me put it that way. We do not have an effective referral system. Effective referral system means that you, the referring facility, know exactly where the person is going to. You have made contact. They are prepared to receive that person. Even sometimes they will direct you on what to do before that patient comes. I'm a gynecologist by training. If a woman is bleeding at a polyclinic, somebody wants to bring to Korle Bu, and they call me, doctor, this woman is bleeding. They are calling me as a gynecologist. I can give direction, do this, do that, and bring. I can set my place in readiness to receive that patient. Currently, doctors have had to rely on using their personal phones to call personal friends that they know. And Nana, you can imagine a typical day that I'm at Korle Bu, I have a patient, the place is full, the patient needs surgery, I have no other option. And I'm trying to reach 37. And there's no dedicated line I can call 37. Now I'm going to find out who did I train with, who is at 37. You call the person, oh, sorry, but I'm not on duty. You can call someone at 1 a.m., you wake up a colleague doctor, and the person is not on duty. You have to call another person and keep trying. That is not a referral system. There must be a central point you can call that will be able to tell you that, okay, we have a bed here, okay, we can receive this patient, we can do that. That is not existent. Referral system goes with ambulance service, and that is not working.
With ambulance service, I think we have a picture to show with regards to ambulance service. I think there's an indictment on all of us if we can have it on the screen.
Exactly.
Yeah.
So you do not have that effective system. I mean, I would have wished that we have that pre-hospital care where the ambulance service plays a critical role. They pick you up from your home. I mean, if you follow the story of this man, I happen to have been part of the Medical Association's committee or delegation that met with the minister to look into this matter. At some point, they ran out of fuel. They had to park their car trying to go and get fuel in a taxi to come back to their car to move. This is not how human beings should be treated. So I think that as a people, as a nation, we must rise up and decide that this is enough. We are not taking any more of this. And that does not stop with us just taking a directive, do not turn patient away again, and we are happy and we go to sleep. And then we lump it all on the doorstep of doctors and nurses and healthcare providers. Now they've been instructed. In fact, there are even calls that we should criminalize it. So if there is no bed, it's a criminal offense. So, and then we are happy. The political leadership have spoken. It does not carry weight if it doesn't come with the logistical support, if it doesn't come with the space needed, the functional space needed. That call should have come, in my view, and the view of us at the Medical Association, with someone saying that the new emergency that have been built for Korle Bu for years, that is commissioned today, need re-roofing today, we are opening it up. The University of Ghana Medical Hospital with over 600 bed capacity, we are opening it up. We are providing tents with beds. We are providing defibrillators. We are sacrificing A, B, C, D to make sure that across the country we can provide this help. That call, that directive should have come with us saying that we have called National Communication Authority. We are setting up a call center. We are employing healthcare personnel to sit there. I mean, something that showed that enough thinking, thought process have gone into it and has come out with a directive that.
But were you not part of the directive? I mean, you are the guys on the ground, so are you just saying, I mean, were you not part of the meeting that came up with the directive?
It's a directive from our employers.
In fact,
and that's what I would say.
That's the issue.
My president is quoted to have said on another platform that this directive is likely to fail. It's likely to fail because it is a typical way we handle issues in Ghana here. The directive is made and we are all excited. The politician has spoken, the minister or whoever has spoken, you must take in all patients, and we are excited. Take in the patient and treat them with what? Take in somebody, in the case of this elderly man who was weak, cannot sit. You don't even have a chair for the person to sit on. You take in that patient and do what? Is it better for that patient to lie in a bench for us to even put something on, or lie on the floor? You understand? So I think that directive should come with something.
I agree. You see, in the absence of all this,
yeah,
the Ghana Medical Association, if you take, let's say, Dansoman catchment area,
exactly,
is there any way, you know, this polyclinic, that clinic, this clinic would come together and say, look, if somebody came to clinic A,
yes,
look, and it's a gynecological situation, you should go to clinic C and not B. If it's a broken leg, you should go to Z and not Y. Good. So that Dansuma would understand it. If all fails, then you move to Korle Bu, and then maybe you come to Jowolo Airport.
Exactly. And now you realize in our statement, we said we should follow the levels of referral. We should follow that. You see, sometimes people move with minor cases to a major place or a tertiary center and occupy beds, occupy space, and people who need that kind of service are not able to get it. People can take individual initiatives. At a district level, you can have a district director who decide that this is how we want to go around. And some smart, innovative things have come up. In the central region, there were situations where taxi drivers were involved because for the lack of ambulances, we're giving stipends ahead of time or promise that if you carry a pregnant woman to the hospital, we'll pay you this amount, so that facilitation of patients to the hospital could be assured. Those individual initiatives can occur, but we need a concerted effort. In Accra here, I know doctors on the Ghana Health Service platform created a WhatsApp for themselves, so where in Obs and Gynae, in obstetrics and gynecology, where if you need to refer a patient from, let's say, Medina Polyclinic to Rich Polyclinic, you summarize the case of that patient and put it on the WhatsApp platform. So everybody within the catchment area sees it and see if Medina can receive or not. But this is a WhatsApp. Somebody can decide to respond or not respond. Could we have a call system that we know that every time we can respond to? some initiatives must be taken at a national level and must be taken at a higher level, and it comes down. Within the body of doctors, a lot of effort is being made to solve these issues. And some of it have been outlined in our statement of some of the efforts that we are putting in. So I think that it suffices to say that the situation is quite sad, let me put it that way. It is unfortunate that at 61 years we are still at this level, but I think our priorities are not right as a nation. If we put health as a priority, especially emergency care, the Medical Association saw this years ago and organized an entire public lecture on emergency medical services. We organized one on road traffic accidents because we see this thing happening and we think we need to respond differently as a people, but we don't get that full support from everybody, especially officialdom.
Let me take a quick break and come back, because it's amazing that health, and it could just affect anyone, any single one. So you wonder, everybody keeps saying 61 years, 61 years. How is it that nothing has triggered us to look? Let's look at this sector, because today is him and tomorrow could be you. Coming straight back. No bed crisis. Like I said, hopefully one day we'll be talking about no Land Cruiser crisis. As a nation, I think we've gotten our priorities very, very wrong. There isn't one civilized country in this world that would have more Land Cruisers for government than ambulances for its normal people, and we're carrying on as business as usual. It's an indictment on anybody who's alive today, including myself, even though I don't even know what to do about it. But since I'm alive, I guess include myself. But Dr. Bernanke,
Yes.
if at 61 nothing has shocked us, then it won't shock us. We've gone, I tried the entra, we've gone past it.
Yeah, Nana, if you followed the coalition discussion on this matter over the last 2 weeks, and more especially 3 days ago, we have spoken what is inside us burning. We have spoken it out. And I want to repeat here again that we have been very hypocritical in managing the health sector over the years. Whether the current government or previous government, there has been this political takeover of the health sector, and they manage it the way they think they want to manage it. And they have violated the constitutional provisions, they have violated the Public Health Act, they have violated most of the protocols set by themselves. And today, I'm still stressing on this point that until the health sector leadership, until our lawmakers begin to change their attitude towards financing the health sector.
Is it until we get angry, or until they get? Because no, I think as for them, they've showed you their card too.
No, for now, why I'm saying this is this is more or less a warning to them that until they do the right things to help the general population, there will be at a time a general population will rise up. And you know the reason why. We cannot understand why, if you follow the Kolebu story, there used to be almost every 6 months you will hear crisis in Kolebu. Then Kolebu have been stabilized. Now that we are seeing Kolebu being stabilized and beginning to prospect, then we instead of we maintaining the good things and build on them, we are beginning to distort them again. That is one of the hypocritical things that I'm talking about. If you pick the University of Ghana Medical School, and you saw the facility that is put there, we borrowed this money, we put these facilities in place, and we cannot use it because the current leadership think that otherwise, when Ghanaians need more services. That is the hypocritical aspect I'm talking about. If you talk about the Amasama, I've forgotten the specific location of that health facility. After building that facility, why are we not putting it into use? That is the hypocritical aspect of it. if you pick the chip compounds that we have built across the country, my records indicates there are almost 1,000 chip compounds. Almost 1,000. It's over 900. Almost 1,000 chip compounds spread in communities that we are not using them because we are not getting the directive to use them. That is what we are talking about. We are talking about training medical doctors. And then we go and, why is it that we don't want to use them, but we will go and, how do you call it, dog? Is it commission or you graduate them?
Graduate.
You go and graduate them. You are not using them, but you go and graduate them. And you tax them to go and be professional. Where? Are you getting the kind of situation we find ourselves? We pass out nurses, and then we say that we are picking them on contract to work for 3 years. Then later on, you will reconsider. Why are we playing with Ghanaians like this? So until we begin to, I mean the politicians, they should let Ghanaians give them the trust. They should let Ghanaians focus on them.
It won't happen. No.
It will not happen.
Because you are the one who's sick and you are not complaining.
But I don't know if I may come in to support my colleague. I think that at 61, if we say if nothing has not shocked us, nothing will shock us. Nothing will shock the leadership because they have nice ways of just calming things down, just managing the people. But I think we can make a difference. I don't think I have given up yet. In fact, the day I would have given up on our healthcare system, I would probably just pack my family and leave this country. I'm a well-trained gynecologist, fully qualified, and can practice anywhere else. But I think that the people of this country and the media that is leading this campaign, and now social media, we must rise up and continue this campaign and not settle for mediocre answers. We must let our leadership know that the Ghanaian deserves better. And this campaign of no bed should not end with a directive, with an administrative fiat. It should continue till we can see the ambulances in our communities. When did the government come into power? And I mean, in all government, and when they come in, the first thing is that they are able to procure vehicles for government. Initially, there was a moratorium on vehicles for ministers and all of that. But we've all seen new registered numbers, vehicles, V8 being driven around. There's no money, yet all other aspects of the state is running. The basic thing that everybody needs almost equally is emergency medical care, because no one knows when the emergency will strike. And all of us, doctors, nurses, lawyers, everybody stands at the same risk. And I think the good people of this country must continue demanding. I have observed the social media demand and the demand in the media, and from us at the Medical Association, we were happy with it, except that we think it's sometimes a bit misdirected. Misdirected because people vent out their frustrations on the healthcare workers. And that is where there is a recipe for disaster. Because whether we like it or not, these are the professionals who we have trained who are continuing to serve us. The trying conditions under which these people are working must be acknowledged. And we must not throw them into a state of despondency. You see, because when you criticize people unduly, I see doctors taking money from their pocket to buy drugs for patients. I've seen a doctor take his own blood, have it checked in the lab to transfuse a patient to prevent the person from dying. I've seen nurses sacrifice for patients. We cannot ignore these sacrifices. If we are going to complain, like I always saying, the individual factors are there. For those few miscreants, let's pick them out, let's deal with them. But let's lay the complaint at the people who are handling our taxes, the people who are supposed to provide us that basic emergency care. I think that our social media campaign of no bed and whatever should continue, like I'm saying, till we can see the ambulances. Should continue till we can see the University of Ghana Medical Center running, till we can see Kolebu's emergency moved into the new one, till in every district, wherever you are working, let's report on the infrastructure deficits. Let's report on the districts that have no doctor, when we have doctors sitting at home waiting for financial clearance. You can see a community, 120,000 people, and there's no single doctor serving these people. Is it fair?
155.
Is it fair?
155.
This is what we should be talking about. And so instead of letting our focus being shifted, and the politicians are very easy to do that, and they like it when they are able to guide all of us into that direction. Oh, it is the doctors, it is the nurses, they are not working, their attitude, they are that, they are that. Move the Ghanaian doctor from here to London, and he's an excellent doctor. What makes the difference? It's not the money, it's the environment. We have the skill, we have the training to perform wherever, but what you need to perform, if it's not there, it's not there. I cited this example on one of the media platforms, that the directive that accept every patient, do not say no bed, and going to sit down. It's like an army commander commanding his army, or his commander-in-chief commanding the army of Ghana that gadgets. Go to fight, go to war without giving them equipment. What that means is that that army is going to be defeated, the country is going to be defeated, and everybody is going to suffer.
Could that directive mean that, look, give first aid before referral? I don't think the directive means that anybody comes to your hospital, is a prisoner, is not going to move on. Could it mean, look, have a look at the patient and then at least know whether this patient is due for Medina 37 or Kolib?
Great. It could mean that. But I'm hoping that you are not attempting to interpret the meaning of the direction of the directive for the person who gave the directive. Because from our point of view, that directive should be accompanied with a few things. Okay, we are not against the directive per se, and we have emphasized it here. I will not condone any doctor or any health professional who would turn a patient away without first even seeing who the patient is. Like you mentioned, the person could have even been dead already, and you are still asking them to be moving from place to place without knowing that the person is dead. You could have stopped that. Or all that the person may need is just to give the person even sugar, common sugar. If it's a diabetic who is gone hypo, if you don't have anything at all, our basic medical knowledge should tell us that if you give that person a Coke, a fizzy drink to just take in, it can survive the person to the next level. Or put a cube of sugar under your tongue, can take the person to the next. This is privileged information we have, that by that privileged position that we occupy, there's a sense of duty of care on us to offer that to the person. So we should. But all that we are saying is that should not quieten us as a nation. That is the point that we are trying to make. It should not quieten us to go to sleep and just relax and hope that everything is well, because it doesn't solve the problem. It doesn't at all.
Dr. Bayo, sorry to interject, but you see, we have been passionate about these issues. Some of the issues you are talking about are the reality. Inadequate financing in the health sector. There's no doubt about it. But I'm talking about practical things that should happen, whether there's an increase in budget or not. That we must see the health worker doing them at the facility level. That they don't need the minister or the director general to be there to give their instruction to do that. For example, you have reported to work. Who is the supervisor to ensure that everything is normal and is ready to discharge duty? You don't need a director general to do this. You at the regional health facility or regional directorate, the emergency unit, you can go there. I have done a lot of mystery surveys myself, and I do them on weekends. Go and see a mess. I've done that severally. Go to the regional hospitals on weekends and pretend that you are sick and start recording the time that you reported to the emergency. You will laugh. I've done that several times, and I have videos, I have recordings just to prove to the leadership that nothing is working even at the regional level when they are supposed to take charge. They are supposed to be responsible, not the director general, not the minister for health. Those are the practical things we want to see them being practicalized. For example, the Nurse and Midwife Council and their teams, their leadership at the regional level. What are the things that they can do about some of these things that come out? To be surprised, you can't even find any article about some of these things, these unfortunate things happening, that there's an article that has been written so that we can study this by the current nurses who are going to school. So they don't see the reality even because they come out from school. So we are talking about the leadership crisis, not just at the ministerial level or at the director general level.
But even at the hospital.
At the hospital.
Unfortunately,
The in charges are there. They do what they want to do because nobody supervises them.
That's all time.
These are the critical
going
things
to
we are talking
allow
about.
us, unfortunately, such a big issue and very little time. But let me give you the number: 024-366-2001. 024-366-2001. It's not for hospital bed. It's if you want a shirt like what I'm wearing. That's Tanti's Fashion. They supply me my shirts. So give them a call and get yourself a shirt. But I want to say thank you so much to Dr. Titus Bayu and Dr. Gabriel Bananko. They are in the forefront of the health fraternity fighting for us. But I think you and I should lead this fight. Just as we said no to Galamsey, maybe we need to come together and say, look, there shouldn't be anything like a no bed crisis. It's embarrassing and an indictment. Thank you very much for watching. We'll always be back to do this all over again. Gentlemen, thank you so much.